Now, John, you had some significant liver disease.
That was the suggestion, yes.
Wasn't a suggestion, there was actual disease.
Right.
And when we looked at it, you actually had early cirrhosis.
Correct.
So that's a liver impairment. And in fact, when you then had a drink, it would take you longer to recover from that alcohol.
That's still the case.
because the liver wasn't able to function normally.
Right.
So one of the things I suggested was that you go through Therapeutic Plasma Exchange.
Right.
What happened?
Well,
So first of all, tell what is Therapeutic Plasma Exchange in your mind? What happened to you physically?
it's an oil change, is for us laymen. In essence, they take your blood.
So they put in an IV in one arm,
An IV in one hand, you're sitting,
and an IV in the other.
right, and you're sitting in a bed or in a chair, and they take the blood out, they run it through a machine, and take 50% of your blood, and then spin the plasma out and throw the plasma away. Like the third time they did it, I noticed they were bringing this yellow bag, and I says, "What's that?" "That's your plasma." I always thought, it's red, it's blood, it should be red, right? No, it's actually, turns out it's the basic color of urine.
So they separate out.
They separate it out and just threw it away.
And they give you your red cells back after they're
Yeah, the
washed
red, white
through the
blood, all
machines.
those, yeah,
And they give you saline back.
right,
And they give you albumin, which is a non-signaling protein, which helps keep the
right.
blood volume in the
Correct.
in your circulatory system so you don't pass out. So, and then what happened to your physical functioning?
Within 2 weeks, I began to lean out. I didn't change my workout routines, didn't change anything really, but within 2 weeks, I'm starting to lean out some, and I'm adding muscle. My workout routines.
And what happened? What did your doctor say about your liver function?
Your doctor, that would be you, said my liver function was getting better.
Yeah, so you actually recovered liver function. I had never seen anyone with cirrhosis reverse it. And you actually reversed the cirrhosis.
And the one thing that...
So we don't know that this is a treatment for that.
Yeah,
but in your case,
and we don't know why
happened.
yet. I mean, because you were more amazed at the varices that I had esophageal varices, and you were more amazed that those went away.
Well, that's part of the cirrhosis going away. So if you don't have the fibrosis in the liver, then you don't back up the blood and you don't have the varices. So you had an amazing change from this. Now, you felt stronger. You felt you were leaning.
I'm 75 now. And so I was 74 when we did this.
A young kid.
I was a young kid, yes. But I was, the more time I spent at the gym, the less results I was getting. I mean, but that's what happens as you get older. You're working out and you're just not getting the same results. It was within weeks that I was I was getting stronger. Visibly, I was adding muscle. That's something that they get a lot of people that will do. I went through Therapeutic Plasma Exchange, and one of the things they noticed at the beginning, especially Dobry's got a lot of cute older ladies, I guess, talking about, they begin to get muscle again. And that, I mean, I've never been athletic or had much muscle, but it's still, it's 7 months later, and I do my 50 or 60 push-ups in the morning. I'm pumping more iron, and it's visible. I've dropped a lot of fat in addition to adding a muscle. So
you then got, since you had to go to California to get this, you then said to me, let's start a company that does this and makes it available to many more people.
Two things happened. I was listening to Pat Cox and you both talking about the effectiveness of this. And, and I, as I do for everything, I said, well, is there a business there? And I couldn't figure out how to launch a business, because to do it, a nationwide business, to make it, as opposed to one clinic, in my mind, it was going to take an enormous amount of money. I mean, like beyond my ability to raise. And then I realized, I woke up one morning, we started talking about it, and we said, we could do this as a franchise. So that reduces the amount of money you need by like 90%. So, okay, let's launch a franchise business. And then we started I had my daughter, and then other people got involved. Let's start putting a model together. Let's start putting numbers together. What's the actual process for launching a business? And part of that was began to realize a company-owned location was a much better idea, but it takes more money. So as it morphed in our conversations back and forth. So we're launching with franchise.
This was the foundation of forming Lifespan Edge.
Yeah, right.
Which has the tagline of longevity is here,
yeah.
Because when you went there, you felt that you were getting longevity.
I have a therapist, a physical therapist that works with me. And 2 weeks later, he was saying, your muscles, your skin, everything's different. And there were a lot of things that I could see within a few weeks. But now, we also need to understand, I did it 4 times in 8 days, because that's what worked in my schedule. Most people are doing it every 2 weeks, every month. They're not just getting one and done. So I had a pretty aggressive
So
procedures.
one of the things that Lifespan Edge is going to be doing with the margin is to find out what the ideal schedule is and the ideal amount.
We don't know what the perfect amount of the perfect schedule is yet.
Right.
Kiprov and others,
That's
the kind of the standard.
Dobry-Kiprov.
Kiprov. They're saying that it's 6, and that's been based on their experience. And so I've got 2 more I'll do sometime this fall. But for me,
How anxious are you to do those 2?
oh God, I wish I could do them tomorrow.
And so when you get when the centers get distributed throughout the United States, rather than just in one site in Marin County in California, you're going to be able to do that. And everybody else is too.
I'm probably going to be the first patient at every, initially for all of our clinics. I want to be there first, just because I want to check it out, of course.
And no benefit to you.
No benefit to me whatsoever. I'd read the AMBAR study. And I'm thinking, because you and I have talked about this previous experience, my mind, I live in my mind. That's what I do. I'm a writer. And I was visibly noticing my mind neurons weren't just firing as fast. And I've complained about that. And you said, your typical warm bedside manner was, suck it up, John, you're getting old.
Wait a second. I'm empathetic.
Yeah. I could tell you stories about the empathy that he had for me when my PSA went up from like 2 to 13, but we won't go there.
So part of what I do. Let me justify a little bit for 20 seconds. Part of what I do is judge how to motivate each patient. And so some patients you can be kind and gentle with and nudge, and some patients you can be moderately empathetic, and some you've got to be a, if you will, drill sergeant with. John was in the drill sergeant camp.
By the way, we've been doctors and friends. He started reading my letter 20 years ago. He's an economics junkie, and I feed his habit.
20, I remember it exactly. It was about 4.5, maybe 25 years ago. And there was an error in something. So I pointed that out to you, and we started a dialogue on this error or non, and you corrected it, and we corrected it, and became friends. And
I finally Googled him and I said he's writing books. But the going back to the study, so I finished it, and 2 or 3 weeks later,
AMBAR study.
2 or 3 weeks later, I was actually disappointed because my mind wasn't working better. I expected to, all the neurons firing.
So 2 or 3 weeks after you had the first therapeutic plasma exchange.
Yeah. And I'm expecting this big difference, and it wasn't there. Okay. And then I realized about 4 or 5 months later, I was working, and I thought, wait a minute, it is working better. My mind is sharper. I've got more energy. I'm waking up earlier in the morning. I'm sleeping less. If I don't do something, if I don't drink, if I have alcohol, I will get up in the middle of the night. But I'm not getting up in the middle of the night to piss. I guess you can say that.
That's a technical term for urinate.
Yeah. Okay. Fine. That's what we in Texas call it. I'm sleeping few hours. I have more energy. I mean, it's just there's lots of differences. I mean, people look at me will tell me that I look different. So.
And so that's really why you said we should bring this to
and
a
we
lot
gotta
of
make, we gotta
people
make it,
and make Lifespan Edge available to a lot
and
of
so
people.
we just started saying, how do you go about doing this? Because it's not an inexpensive procedure. It's not as well known. It's kind of, I mean, I liken it to my seminary days. We've got good news. We have to be evangelists. And so we need to, but because if people hear the good news, they're going to want to do this.
Well, the interesting thing is, after the AMBAR studies came out, I read it the first day it was published, and I called, since it had been done at the Cleveland Clinic, I called our head of the neurologic, what we call the Lou Ruvo Center for Brain Health at the Cleveland Clinic, and I said, where's this being done? It's a breakthrough. And he said, I don't know anything about it. And I said, well, it's being done at the Cleveland Clinic. We're one of the sites. He said, really? And literally, it took me going for about 2 weeks of trying to find out where at the Cleveland Clinic
Well,
it was being done.
you're so large, but it.
No. But the point is that almost every neurologist thinks of drugs, and virtually none of them think of therapeutic plasma exchange as a tool. And it is both less expensive than the current drugs, less risky. There virtually is, when you look at
get results.
When you look at the AMBAR studies, there were no real serious adverse. There's always a risk when you put an IV in of an infection. There's a risk of hypotension.
The 1% range.
Lower than that.
Yeah.
But the point is that most neurologists still think of drugs, the Eli Lilly drug that pulls out, but it can cause brain edema, it can cause hemorrhage in the brain. This doesn't do any of this, and this seems to make the skin, the liver, all three different types of tissue in the human body, if you will, regenerate or what we call reboot. So that's why Lifespan Edge is going on, and we're going to have the research as a IP device.
There you go. Thank you, Mike.